We now talk about retention of damp heat in the spleen. The major difference between this and damp cold invading the spleen is the presence of heat symptoms and signs. Like damp cold invading the spleen, this pattern can be both acute and chronic. An acute condition will occur when there is an invasion of exogenous pathogenic qi, whereas a chronic condition is usually the result of spleen qi deficiency, creating dampness, or consuming food and beverages that create dampness or damp heat. Dampness, when it stagnates, will generate heat and transform into damp heat. This process is accelerated if there is already heat present in the body. This will typically be liver qi stagnation heat. This pattern is often characterized by there being a chronic condition of latent damp heat, which flares up every time food or beverages are consumed that generate damp heat or damp heat. In general, the symptoms will be milder and less pronounced when there is a chronic condition. This is due to accumulation of damp heat in the middle jaw, leading to disturbances of the functions of the spleen and stomach in transporting and transforming. It is also called damp heat in the middle jaw or damp heat in the spleen and stomach. Key symptoms: functional impairment of the spleen and stomach in transporting and transforming, along with retention of damp heat at the same time. Epigastric fullness, nausea, and sticky yellow coating are enough to diagnose damp heat in the stomach. Clinical manifestations: fullness in the abdomen, poor appetite, nausea, loose stools with a foul odor, heaviness of the body and limbs, thirst with desire for drinking in small sips, rising and falling fever, which cannot be relieved after sweating, jaundice of the skin and sclera with a fresh, bright yellow color, itching, a red tongue with a yellow sticky coating, and a soft and rapid pulse. This pattern is caused by invasion of a damp heat pathogen or excessive intake of acrid, warm, fatty, sweet foods or alcoholic drinks which produce damp heat. Invasions of exogenous damp heat, such as the ingestion of contaminated food, living or working in hot and humid conditions, and direct contact with viruses, bacteria, and other pathogens that have a damp heat nature. The excessive intake of foods that have damp heat generating energy can be both a root cause and an aggravating factor. Damp heat can often arise as a consequence of chronic spleen qi and damp conditions. Dampness obstructs the middle burner and prevents the descending of stomach qi. This causes nausea and a feeling of fullness of the epigastrium. Dampness is sticky, hence the sticky taste and sticky tongue coating. A feeling of heaviness is caused by dampness as this obstructs the muscles. The blocked nose and yellow nasal discharge are due to dampness in the stomach channel on the face. This is a common cause of chronic sinusitis. The heat part of damp heat causes a thirst, but the obstruction of the middle burner by dampness makes the patient reluctant to drink. This may seem a strange symptom, but patients do report it. The dull yellow complexion and slippery pulse reflect dampness. Damp heat in the stomach frequently causes symptoms on the face due to stomach channels such as facial pain and nasal discharge, as in sinusitis. So damp heat in the spleen, etiology: exterior damp heat, eating contaminated or unclean food, possible background spleen qi deficiency. Signs and symptoms: fullness of the epigastrium and lower abdomen, epigastric or abdominal pain, poor appetite, feeling of heaviness, thirst without desire to drink, nausea, vomiting, loose stools with offensive odor, yellow urine, heavy cumbersome limbs, tenesmus, feeling of heat, low-grade fever unabated by sweating, headache, bitter taste, yellow sclera. Pulse: slippery and rapid or soggy. Tongue is red with sticky yellow coating. Treatment principle: clear heat, resolve dampness, and regulate the intestines. Acupuncture treatment: spleen 9 to resolve lower burner damp heat, do 9 to resolve damp heat, bladder 20 to resolve dampness, ran 9 to harmonize the intestines, stomach 22 to regulate intestines, bladder 22 to regulate spleen and stomach, stomach 25 to regulate large intestine, spleen 6 to resolve damp heat, LI 11 to clear heat and resolve damp, GB 34 to resolve damp heat, REN11 to harmonize middle burner, stomach 28 to regulate lower burner, and LI4 to clear heat. For yellowish or yellowing of the body or eyes, we drain liver 3 and GB34. For itchy skin, add spleen 10 and Qi Yang. For pronounced heat, drain Do 14, prick LI1 to bleed. Needle with drainage, no moxa. It is essential that the person with chronic damp heat invading the spleen avoids, as far as possible, food and beverages that create damp heat, dampness, or heat. It is usually not enough to avoid sugar, sweets, cake, and so on. They should also avoid dried fruits, stevia, artificial sweeteners, and anything else that has a concentrated sweet flavor. Alcohol, hot spices, including chili, pepper, chocolate, and garlic will also be problematic, as will dairy products. While they should avoid things that create damp heat, they should try to consume a diet that is beneficial for the spleen.